actually becoming a psych nurse, I did not know that there were more areas to psych than just inpatient and emergency department crisis stabilization. In today's video, I'm going to share with you all of the settings in which a psych nurse can work. Hi everyone, I'm Danielle Denise and welcome to my channel. I'm a new grad psych nurse, and here on my channel I document my journey to become a psychiatric and mental health nurse practitioner. Today's video is a part of my new series trying to convince you to become a psych nurse too. And even if you don't want to and just interested in mental health, please feel free to stick around. Today's video is all about the different clinical practice areas that psych nurses can work in. Prior to me becoming a psych nurse, I only knew of what I saw in my inpatient clinical rotation and what I'd see in the emergency departments as far as crisis stabilization, and typically any registered nurse can take that role, not just registered nurses who specialize in psych. And just to keep this video within a reasonable amount of time, I'm going to primarily focus on just registered nurses, whether you have a BSN or associates, versus going all the way up into advanced practice registered nurses, such as my psychiatric and mental health nurse practitioners out there. I'm gonna keep that separate just so that we can keep this video condensed. So just as an FYI, before we get into the different settings that psych nurses can work in, I just want to let you guys know where I got this information from. One, from personal experience, because as you guys know, I don't take this typical route for anything. So of course I didn't do that with my job. So one area is from experience. The other is from the American Nurses Association. I picked up this psychiatric and mental health nursing standards and scope of practice book. This video is totally not sponsored by them. I just have that book because along this journey of becoming a psychiatric and mental health nurse practitioner, I want to be certified in my specialty, so I'm trying to learn all that I can and be the best psych nurse that I can be along the way. So going in order of most acute to least acute, the first area or setting of clinical practice that psych nurses can work in is in crisis stabilization. These are psychiatric emergency services. This is before patients even go inpatient. So these patients don't even have like their 5150 72-hour hold yet. This is when they are at the most acute, full crisis, need to be stabilized to even get to inpatient. And this could be in the EDs, at psych hospitals crisis stabilization units, or individuals picked up by a mobile crisis team. Patients don't always have to get their hold this way. Patients can also go into acute inpatient voluntarily, but if you do have a hold or you go in voluntarily, acute inpatient is probably where you'll end up next. And acute inpatient units can be found at general hospitals, hospitals that have NICUs, telemetry, ICU, EDs, those hospitals. Some of them have them, not all of them. And then at independent psych hospitals, like the typical only psych, that's all they take care of, psych hospitals with different units at the hospital. Typically, less acute than inpatient is intermediate and long-term care facilities. So this is also at psych hospitals, or it could be a boarding care. And then the outlier, and why I said typically, is forensic mental health units. Intermediate and long-term care facilities are places where patients will stay anywhere from weeks to months. And for long-term care, the minimum is 3 months. These patients are typically more stable than being inpatient, but are still at risk of harming themselves or others, and typically still unable to care for their own basic needs. The intermediate and long-term care outlier is forensic psych units, because these are the units where patients are usually on these units or placed there because they have committed a crime related to mental health. This could be a whole nother video talking about how people have claimed to have mental health issues and ended up there, and said that they've come out worse than when they went in, but that's not the video we're talking about now. We're talking about, as nurses, what these units look like and where psych nurses work. So those are typically dealing with people who have committed crimes and are arrested, and it was related to having a mental health disorder. The next one, which is even less acute than long-term care and intermediate psych, is residential psych. Now, people think that residential psych is the same as long-term care because of the name, because patients tend to stay for months at a time. However, with long-term care, patients are required to stay at least a minimum of 3 months. With residential psych, there's no requirement to stay a certain amount of time or a minimum amount of time, but patients tend to stay at least 2 weeks or more. And It is not the goal to have them stay in residential care. The goal is to prepare them for independent living. So they are provided 24-hour nursing care. They are also provided psychoeducation, therapy, and life skills to help them prepare for independent living. And if they're not ready yet, that's okay. They can either be stepped back up to intermediate or a long-term boarding care facility, or they can be stepped out to a partial hospitalization program or intensive outpatient program, which I'll talk about next. So partial hospitalization programs or intensive outpatient programs are like your 1 foot in, 1 foot out. You're hospitalized, but you're also kind of outpatient. So typically it's like a program where they provide housing, but you're not under 24-hour care or watch like you would be if you were residential. So with PHP or IOP programs, patients are provided housing, or they basically pay for housing through their program, and they stay there while they participate in hospitalization programs throughout the day. And that's when the nurses are working with them. There's a sense of independence because the patients are allowed to kind of live alone and be alone and not be under 24-hour watch. They're being held accountable to do so and also show up for programs during the day. And lastly, the least acute area to work in, of course, is outpatient psych. Not to say that you won't encounter people that are in acute stages. Outpatient psych is typically like how you would see any other area of outpatient healthcare functioning. No units where you are watching patients throughout the day. Once you go home after your shift, there's nobody still there, living there for days and times on end. This could also be done through telehealth or community health nursing. As community health psych nurses, you provide education to teachers, colleagues, friends, people just out in the community about the signs of when people are in mental health distress and what to do about it. So these are all of the areas of clinical practice for psych nurses, but these can also be specified based on types of psych nursing treatment like Alzheimer's and dementia, substance abuse, eating disorders, developmental disorders, and even further specified based on gender and age. Like there's adolescent psych, children, there's adults, there's older adults or geriatrics. It can go further and further. Like you can find your niche or your favorite area in psych. It's there. There's so many more. There are so many more. And that's it, guys. I truly think we need more psych nurses in the world. I don't know if you can tell, but this video is definitely me trying to convince you where you can work. Like if you like that fast-paced ED lifestyle, you might like crisis stabilization or acute inpatient, because things are always changing. And even on acute inpatient, you have acute on acute inpatient, and then you have like long-term care within inpatient psych hospitals. Like there's a lot of options if you want to just dive in and take a peek. This is just surface level. Like this video is just giving you just a little peek. It's truly a different arena of healthcare that is underserved no matter where you go within the country or the world at that matter. And psych patients could be either you or me if it came to it. And I think we all deserve someone kind, passionate, and patient to help us out. And if that could be you, I mean, let me know if any of these areas were of interest to you down in the comments. I'm trying to bring you guys into the psych nursing world. And even if you're already considering it, I hope that you know now that you don't end up just like me thinking, oh, there's just inpatient or just crisis stabilization. There's more options, and there's more different types of people that you can work with. And if you choose to come into psych, please remember to take care of yourself. That is number one, and that is all I want. Don't think I'm just trying to rope you in. I want you to know that it will be so rewarding, challenging, but rewarding. So let me know what you guys think about this video in the comments. Don't forget to subscribe and give me a thumbs up, and I will see you in my next video. Bye.